Hi, I'm Gary Bebo, and this is the March CEO Connection. Uh, as in the past, it's my honor to have physicians come and speak to me about different things in their practice or just what's happening at the hospital. So today, I'm really pleased to have with me Dr. Anthony Abraham, who's a general surgeon who joined us in November. Dr. Abraham works with Dr. Lambert in the Batesville surgery, and Doc, I'm really pleased to have you with us. You know, we obviously talked to you. Gosh, it was over a year before you actually did come,
Yeah.
and I know you're finishing up your training, and it was quite a move for you to come from Miami, actually, out of Miami to come
Yeah.
to Batesville. What made you decide to come to Hoyer River Medical Center in the Batesville area?
Well, as I said it before, I attribute it to your amazing recruiting department and your marketing department because to get a Florida boy to leave Florida and come to Arkansas is a pretty impressive feat. So we just came up here, and of course, we had already heard of the Southern hospitality and how nice everybody is in the South, and Florida really isn't the South, so to speak. But after visiting here, we just absolutely fell in love with the town. It's not just scenic and beautiful and has that classic home small town feel, but the hospital was state of the art. The staff was very friendly and eager to help. We met all of the doctors that would make the decision whether or not that they would want me to be on staff, and within a few days they had offered me a contract. And so we were so impressed and so flattered by everybody's eagerness to get everything moving and to make things as expeditious as possible. We just couldn't say no. I mean, we were very impressed.
You know, being fresh out of school, I bet you really benefited from and enjoyed working with Dr. Lambert.
It has been an absolute amazing blessing, and Dr. Lambert, I can't tell you how much it helps me out having him available. And and it's not just Dr. Lambert. Dr. Jeffries and Dr. Yarnell, Dr. Posey and Dr. Alexander, they've actually all chipped in, and I almost feel like I'm kind of being taken under all their wings. I really always feel comfortable being able to call them. They never make me feel bad about asking them questions, and I really appreciate it.
I know I've heard a lot of really great comments about you and how much they enjoy having you be on staff, and just bringing enthusiasm and new ideas to the staff. So it's really a pleasure to have you here. You're speaking on March 8th at the community health event in the Josephine Ray Rogers Center. You're speaking on digestive health.
What we're trying to do is raise the level of education at a community level for patients who are out in the community that may not realize how serious it is to kind of skip some of the screening exams. All these screening tools, they're not there so that we can make money. They're there so that we can save lives,
Yeah. I know that the community will really benefit from your presentation. You got a new baby in the house,
Got
I
a new
hear,
baby.
And probably having some fun times with the baby and also lacking of sleep, I trust.
That would be the explanation for the bags under the eyes. And if I had hair, I would no longer have hair. But she is such a blessing. Her name is Ariana Robin. She was born on January 8th, 7 pounds, 15 ounces, and she's literally the greatest thing that has ever happened to me. Next to my wife, our wedding day was the greatest, but the birth of our baby was the second greatest day of our life, of my life at least. And I never thought I could love anything so much. She really is beautiful.
Well, we're really pleased to have you and Natalia part of our medical community, and welcome to Batesville. Thanks for
Thank
coming
you, sir.
and being
Appreciate
with me
you
today.
taking the time
Thank
to
you.
have me here.
Thank you. I wanted to recognize two of our employees of the month again this month. At Waver Medical Center, Autumn Jones, a RN in our cardiac rehab department, was recognized for demeanor. Autumn has been an employee at Waver Medical Center for 11 years, 4 in cardiac rehab. Each month these employees get nominated for Employee of the Month, and I'm proud to say that I'm the one who nominated Autumn this last month, and so I really appreciate the committee selecting my nomination. At Stone County Medical Center, Donna Ramsey in the Environmental Services Department was recognized for her friendliness. Donna has been at Stone County Medical Center for 10 years. Please, when you see Autumn and Donna, please congratulate them for their recognition. On March 22nd, we have a new physician joining the staff at White River Medical Center, Dr. Mark Wright, who is a vascular specialist. Dr. Wright will be located at the White River Medical Center Surgery Clinic, and at some point in the future, I'll have Dr. Wright on the CEO Connection to introduce him formally to you. Two new additions to the administrative team. Steve Lang is our Associate Administrator of Revenue Cycle. Steve's been with us since October of 2013. And we just recently promoted him into the administrative team. In addition to Steve, Jody Smotherman is now the Associate Administrator of Graduate Medical Education. Jody's been with White River Medical Center since June of 2003, and he is now responsible for giving us steerage and giving us direction on starting up our residency program, which will begin in July of 17 with internal medicine, and then July of 18 in family medicine. So Jody's going to do a great job in providing leadership there. And so when you see Steve and Jody, congratulate them on their promotions to the administrative team. In December, we had employee forums wherein we presented important metrics for the hospital. And for example, we talked about our service metrics, our quality metrics, our employees type information, our financials, and our volume statistics. All of those are intended to bring you all up to date on how the hospital is doing. I think it's really important that even during this interim period between the employee forums that I give you some updates on those metrics. And it's really important that I make the CEO connection meaningful. Because one thing we know for sure is that it's a form of security for employees to know the hospital is doing well. It's important that I provide a trusting environment, that we have compassion within the organization, and also just to make sure that I can provide hope that this organization will continue to do well in the future. At the employee forum, I ask for feedback from employees about things that they'd like to have addressed at the next employee forums, or just suggestions for improvement. And so today and in the future employee CEO connections, I'll try to address some of those. For example, at the last employee forum, there were several comments about our hiring practices, and in particular, there was comments about that we really need to work hard at hiring the right employees here. That we need to hire those that are kind and like to interact well with patients and with fellow employees. That we really do a good job in the selection process of the quality of the employee. And so, those comments ring true for us. And I've talked to Gary McDonald, our Associate Administrator for Human Resources, and in the next CEO Connection, I'm going to have Gary come, maybe along with Hope Caraway, and we'll talk a little bit about how we go through right now in the selection process to give you more feedback there, and maybe you can give us some feedback on how we might be able to do it better. So in the future CEO Connections, I'll talk a bit about feedback I'm getting from you folks, and I'll make this more meaningful and directed towards those things that are of most interest to you. We've got a great organization. We got a lot of great things on our slate right now, and a lot of good things that we've yet to accomplish. So I'll try to change the CEO Connection in the future to perhaps continue to cover some of the things we have in the past, but also to try to directly address those things that are of most importance to you by way of your comments, and make them more meaningful. So we have a whole calendar of events of things coming up in March. In your pillar boards in your departments, there should be a list of those calendar events, and so please refer to those and attend as many of those as possible. Any suggestions you have to make this CEO Connection better, or how we can make the organization better, we welcome those, and so please provide us your feedback. So you have a great month.